to take a moment to welcome you and introduce you to Patty Sanchez. She is our Heart Failure Nurse Navigator. So today she will be talking about what is heart failure. If you have any questions, please enter them into the chat or the Q&A. And Patty, I will hand it over to you.
Great, thank you, Shanna. Hello, everyone. My name is Patty Sanchez, and I am a registered nurse here at North Kansas City Hospital. And I've been part of this organization for 24 years in different capacities. And the most current is the Heart Failure Navigator role, which was created in October of 2019. The goal is to improve patient outcomes, reduce hospital readmissions, and provide individualized heart failure education through the continuum of care. So my goal today in this presentation is to educate on what is heart failure, what are the common signs and symptoms, treatment, and how to prevent heart failure. By being knowledgeable and in control of your heart failure, the goal is to be able to live a healthy life, continue to do the things you want to while being able to manage your heart failure. So what is heart failure? A healthy heart pumps blood to all parts of the body. When the heart no longer can do this, a person has heart failure. It occurs when the heart muscle does not pump as well, which causes fluid to build up in your lungs and tissues. Can heart failure be treated? Yes. While the term heart failure may sound frightening, it's usually a treatable condition. The symptoms are what brings people to the hospital, and many times is the first time they hear the word heart failure. Heart failure usually does not sneak up on you, but develops over time and due to a number of reasons. It's important to know if you're more likely to get it so you can take the steps to prevent it. Causes of heart failure. There are several causes of heart failure, as you can see listed here. Heart failure is a result of many different diseases that has caused the heart to weaken over time. So it is very important to discuss with your doctor what is the underlying cause of your heart failure, to develop a patient-centered treatment plan specific to your heart failure symptoms. Symptoms of heart failure. These are some of the signs and symptoms of heart failure. If you have any of these symptoms listed, it is very important to call your doctor to address the symptoms early to prevent complications or hospitalizations. If you have been hospitalized, it's also important to know who to contact to follow up and notify of symptoms. It is important not to ignore these symptoms, even if they do not bother you. It could mean that you are getting into trouble with your heart failure and you will need to call the doctor as soon as possible. So what can you do? These are simple steps to prevent heart failure, but some of them will require hard work and discipline on your part. Giving up salt or tobacco can be challenging, but if you set realistic goals and use the resources provided to you, you can be successful in managing your heart failure and have a better quality of life. Treatment options for heart failure. With treatment, the signs and symptoms of heart failure can improve and the heart can become stronger. Treatment can help you live longer, feel better, and do the things you want to do and spend less time in the hospital. Your doctor will help you decide which treatment plan is best for you. Treatments include medicines, procedures, and surgery. And the doctor will work with you to see which treatment plan is best for you depending on how severe your heart failure and your symptoms are. Heart failure cannot be cured, but it can be treated. So you're the most important piece of the puzzle and have the power to do the things in order to feel better. The more you know, the better your health can be. Heart failure is a chronic condition that will need lifelong management. Now I'm going to talk about medications. Taking your medications is a very important part of managing your heart failure, and you and your physician will develop a medication regimen specific to you. When you are taking a medication you do not understand, ask your doctor or healthcare provider to explain and educate you. Make sure you are refilling your medications on time so that you don't miss any doses while you're waiting for refills. Common heart failure medications. Your doctor will prescribe different types of medications to treat your heart failure specific to you and will adjust them according to your symptoms. It is important to know your medications, the purpose, and side effects. It is also important to let your doctor know if you're taking any over-the-counter medications and supplements to make sure they do not interact with your prescribed medications. There are different classes of medications used to treat heart failure and improve your heart function, decrease your heart failure symptoms. One class is called ACE inhibitors, angiotensin converting enzymes. These type of medications help the heart relax so the blood can pump efficiently. Listed are the most common side effects and commonly prescribed ACE inhibitors. The second class of medications I will talk about is called ARBs, angiotensin receptor blocker. Like the ACE inhibitors, they decrease the workload of the heart to improve the blood flow. It is important to know the side effects and to notify your doctor if you're experiencing any of the side effects listed to discuss different treatment options. Again, I've listed the commonly prescribed ARBs that the doctor may prescribe depending on your symptoms. Beta blockers is another class of medication that your doctor may prescribe to treat heart failure. They help the heart pump better by reducing the workload of the heart. Too much potassium can lead to erratic heart rhythm and kidney failure. So your doctor will closely monitor your potassium level closely. If you are prescribed a beta blocker, your healthcare provider may recommend that you limit your consumption of foods high in potassium, depending on your potassium levels. For example, foods high in potassium are like bananas, tomatoes, avocado, kale, anything green leafy. You want to stay away from that depending on what your potassium levels are. And again, listed are the side effects as well as the commonly prescribed beta blockers. Diuretics is another class your doctor may prescribe. You may have known it to be called a water pill. This is a class of medication that helps get rid of the extra water or sodium so the heart does not have to work as hard. Your doctor will work closely with you to prescribe the correct dose that is effective to manage your symptoms. Your doctor may check your potassium level as well when prescribing a diuretic and add potassium supplements or extra dietary potassium to your medication regimen if needed to counteract the effects of low potassium levels, sometimes caused by diuretics. And again, listed here are common side effects and commonly prescribed diuretics. Watching your weight and symptoms. Monitoring your weight and symptoms is one way to help manage your heart failure and decrease further complications. When you eat more food than normal, our body weight will go up, but it is gradual. However, when we hold on to fluid we don't need, you will see your weight go up quickly, which may mean you are developing heart failure and need to notify a healthcare provider to address your symptoms. Daily weight monitoring. It is important to weigh yourself daily to help manage your heart failure. The best time to weigh is in the morning. Start this habit after you wake up, use the bathroom, and then step on the scale. Do this before you dress or have breakfast. This weight is generally the lowest weight of the day. It's important to keep a record and bring your weight chart to all doctor's appointments. This may also be a good time to check your blood pressure as well and notify your doctor if you're symptomatic or if your weight is up 2 pounds in a day or 5 pounds in a week. Heart failure zones. When we talk about heart failure zones, it is simply an easy tool to use to help you know how well your symptoms are being managed. We use the color of the stoplight to help you remember. Green means good. When you're in the green zone, this is where you feel the best. It is where you have the least signs and symptoms of heart failure. This is a zone you want to stay and be in. You are not having any symptoms or problems with swelling, tiredness, chest discomfort, shortness of breath, or weight gain. The yellow zone is a very important zone for you to know about. This is the time to work very hard to avoid being hospitalized. Most of the time, if you call your doctor with any symptoms listed here, they will take action to treat your symptoms. Even if you do not feel bad or have only one symptom, it is important to contact your doctor and report your symptoms immediately. Remember, the goal is to keep you out of the hospital. If you're experiencing symptoms in the yellow zone and do not report them, you will probably end up in the red zone. If you have any symptoms listed at any time in the red zone, you will need to call 911 immediately and be seen in the ER. Please do not waste any time if you have any of these symptoms. Healthy lifestyle changes. Salt is like a sponge. It makes your body hold on to water. Too much salt in your diet can make you gain water weight. Avoid eating salty foods. Take the salt shaker off the table and do not add salt to your food. It can be difficult to change your eating habits. It may take time before you enjoy the taste of low sodium food, but your taste buds will adjust. Let's look at your diet a little closer. It is very important to follow a low sodium diet. It can mean less time in the doctor's office and in the hospital. Did you know that 1 teaspoon of salt contains approximately 2,300 milligrams of sodium? Your total daily intake, which is the food you eat and what you add to your food, should be less than a teaspoon and no more than 2,000 milligrams. These are some examples of foods high in sodium that you should avoid. Just not using table salt is not enough to keep from gaining extra fluid. The best thing you can do is learn how to read nutritional labels, which we will look at more in detail. Most people with heart failure must limit their daily sodium intake to less than 2,000 milligrams per day. In order to stick to your limit, you will need to know how much sodium is in the food you eat. This information can be found on packaged food labels. When evaluating the label for sodium content, pay special attention to serving size and servings per container. The amount of sodium listed is per serving, not for the whole package. If you eat more or less than what the manufacturer considers one serving, you will have to do the math. So here's an example of a nutrition label, and we'll go over the steps. So step 1 is you're going to look at the serving size. So for this specific food item, the serving size is a half a cup. So step 2 is we need to look at the sodium per serving. So and compare it to the serving size, which is the amount you'll be eating. So for example, this item has 250 milligrams of sodium in a half a cup. If you were to eat 2 servings, which would be 1 cup, you would double the amount of sodium, which is 500 milligrams of sodium. Remember, your total amount of sodium you consume in a day is 2,000 milligrams. So step 3, you should choose food items less than 200 milligrams or 8% of the daily value. So let's look at another example. And we'll follow the steps. So step 1 is we want to look at the serving size, which is 1 cup. And then we're going to look at the sodium content, which is circled in red, which is 470 milligrams. Again, if you were to eat the entire container, which is 2 cups, then you would double it and it would be 940 milligrams. One thing to note is when it comes to sodium, the percent daily value is based on 2,400 milligrams a day, not your goal of 2,000. So this means the serving is actually a higher percentage of your daily limit than what is listed on the label. Checking the percent daily value for sodium is also a good way to monitor your sodium intake. The daily value for sodium is less than 2,400 milligrams per day. If the percent daily value is 5% or less, that food is considered low in sodium. If the percent daily value is more than 20%, it's considered high in sodium. Remember, if you have more than one serving of a food or drink, you would always need to multiply the percent daily value for the sodium. Next, I'm going to talk about sodium claims. So the following table includes sodium claims you'll find on packaged foods. Knowing what these claims mean can help you eat less sodium. I've also included how many servings of these foods you can eat every day. This is called your recommended daily intake. So here are the different sodium claims you will find on packaged foods. So for example, if there's a food item that says sodium free, it means that it has less than 5 milligrams of sodium per serving. So your recommended daily intake is unlimited. If the food item says salt-free, it also has less than 5 milligrams of sodium per serving. And the recommended daily is also unlimited. Now, if a food item says low sodium, it has 140 milligrams of sodium or less per serving. So the recommended daily intake would be 4 servings daily. And then if a packaged food item says very low sodium, it has 35 milligrams or less of sodium per serving. And then the recommended daily intake is unlimited. So it's very important to know the different sodium claims to know how much sodium in each serving. Most of the sodium you eat comes from packaged and prepared foods and drinks. So it's very important to read the nutrition fact labels to find the sodium content. About 75% of sodium that you eat comes from eating packaged foods. May not taste salty. They may still have high sodium content. For example, cereal, breads, and pastries. So we ask, what foods can you eat? We told you not to eat salt. Here are a few examples of what you can eat. Limit food items in boxes and cans which contains high amounts of sodium. So here are some examples of heart healthy items that you can eat. Shopping tips. I have many patients who have questions about shopping for low sodium food items. I have a few shopping tips to help when you grocery shop. First, it is important to read the nutrition label, as we discussed, on all your food and drinks items. I also recommend talking with the staff at the grocery store for assistance. Many of them have dietitians available to assist with selecting food items low in sodium. Also, there are some apps that are available to track your daily sodium intake and provide specific sodium content for certain foods. They also can provide recipes that are low in sodium as well. It's important to choose canned vegetables labeled no salt added. Don't use salt substitutes unless your doctor approves them. They may contain potassium, which can be harmful to people with certain medical conditions, such as kidney failure, and also, as we talked about, can affect the medicines that you're taking. Some snacks are very high in sodium. Buy unsalted snacks such as pretzels, nuts, or chips. Eating at restaurants. If you're eating at restaurants, there are things you can do to reduce the amount of sodium in your foods. Many items in restaurants are high in sodium, especially the condiments, like the gravies, the sauces, and the dressings, all the good stuff, the marinated foods. So when dining out, you can order your meal without these additions and ask them to be on, to put them on the side. And you can dress your salads with oil and vinegar instead of the prepared dressings. And ask to have your food seasoned without salt or products high in sodium. Also, many restaurants now provide a list of low sodium food choices. And many times you may be able to ask them to provide you with that list. When it comes to alcohol and caffeine, these both can affect your heart failure and medications. Be sure you discuss this with your doctor. Please consider very strongly quitting smoking and using tobacco. It will help you live longer, feel better, and will help ease the workload of your heart, which will slow the progression of your heart failure and prevent further complications. Regular exercise is very important. It can help prevent heart failure, strengthen your heart, and increase your energy levels. I've listed examples of why exercise is important. You can see here it improves muscle tone and strength, improves balance and joint flexibility, strengthens the heart and cardiovascular system. So exercise has a lot of benefits, and especially with heart failure patients, it can reduce the chance of having future heart problems. Cardiac rehabilitation. Ask your doctor about outpatient cardiac rehabilitation program to assist with developing the best exercise program and assisting with lifestyle changes, such as heart healthy diet, quitting smoking, weight loss, and stress management. If your doctor recommends cardiac rehab, they will schedule an appointment for an initial assessment to evaluate if you qualify. Cardiac rehab may not be covered by some insurance companies for patients with heart failure, so it's important to call your insurance company first. Also, your doctor may refer you to a heart care clinic to assist with heart failure management. The heart care clinic focuses on providing heart failure education, dietary and medication compliance with patients newly diagnosed with heart failure and chronic heart failure patients. Patient education is the essential part of the program. The Heart Care Clinic works closely with the Heart Failure Nurse Navigator and the cardiology office to ensure appropriate referrals are made to the Heart Care Clinic. The Heart Care Clinic is an added resource to help manage your heart failure, but you still need to continue to follow up with your physician as directed. The next slides, I will talk about fluid intake and limiting your fluid intake to no more than 2 liters, which is 2,000 milliliters per day. Drinking too much fluid will cause weight gain, shortness of breath, swelling, medicines will not work effectively, and follow any fluid restrictions advised by your physician. This slide shows what consists of fluid intake, which is all the fluids you consume throughout the day. It includes all soups, coffee, tea, juices, water, and even ice cubes. Again, as shown in the previous slide, fluid is anything that you drink throughout the day. So fluid measurements. So 8 cups of fluid is equal to 64 ounces, which is equal to 2,000 milliliters, which is also equal to 2 liters. And then drinking an extra 2 cups of fluid will cause to gain a pound of fluid. Many people ask, what can I do to prevent heart failure? These are some of the things you can start doing early on to prevent heart failure. It is vital that people learn to identify and manage disease risk factors early, such as heart healthy eating, regular exercise, and seeing a doctor to measure blood pressure, cholesterol, and weight. You can lower your odds of getting heart failure, and the earlier you start, the better your chances. So, like we talked about, monitoring your blood pressure, knowing your medications, taking them as prescribed, notifying the doctor if you have side effects, not stopping your medications until you speak to the physician, checking your weight daily and monitoring your symptoms, exercise, keeping a low sodium diet, watching your fluid intake, limiting your alcohol and caffeine, and then going to your doctor's appointments and heart failure clinic. Bringing it all together. You can reduce the impact of your heart failure by following these steps. These 6 steps that I have outlined here will empower you to be in control of your heart failure to be successful in managing your heart failure at home. So these 6 steps can help you to have heart failure success. Again, reinforcing the importance of weighing daily, weighing at the same time, first thing in the morning, writing down your weight and comparing it to your previous weight. And most importantly, calling your doctor if you gain more than 2 pounds in a day or 5 pounds in a week. Number 2, again, taking all your medications as prescribed. Don't skip any doses, even if you feel well. Letting your doctor know if you're having any side effects to your medicine. Checking your medicine bottles every week and making sure you're refilling them before you run out. And taking your diabetes and blood pressure medicines as directed will also help manage your heart failure. Number 3, again, limiting your salt and fluid intake. As we talked, reading the food labels, keeping your total salt intake to 1 teaspoon a day, which is 2,000 milligrams, and not adding any salt to your foods, and keeping total fluid to 2 liters. Number 4, follow an activity program. Moving will help you and have more energy and feel better, and get with your doctor to start a exercise program that fits best for you. Number 5, knowing when to get help. Call 911 if you have severe chest pain and shortness of breath, fainting or passing out, and call your doctor if you're in the yellow or red zone. And 6, keeping all your medical appointments. It's important to keep all your medications and weight log and bring them to each doctor visit, and make sure you're getting your labs drawn as ordered to make sure that they are prescribing the correct medications depending on your labs. Summary. Proper treatment can improve the signs and symptoms of heart failure and may help some people live longer. Lifestyle changes such as losing weight, exercising, reducing salt, and managing stress can improve your quality of life. Visit your doctor often. Early diagnosis potentially slow the process of disease progression, and then some causes of heart failure are reversible. Heart failure is a long life disease, just like high blood pressure and diabetes. You can reduce the impact of your heart failure by doing these things outlined in this presentation. By following this plan, you can manage your heart failure and improve your quality of life. I have listed the website for the American Heart Association, heart.org. It has updated information and tools easily accessible regarding heart failure management. It has the latest heart health and prevention information and exclusive invitations to hear from health experts. It also has opportunities to get involved. This concludes my presentation today, and thank you for taking the time to listen and the opportunity to talk to you about heart failure. I can be reached at patricia.sanchez@nkch.org for any questions. Thank you.
Patty, thank you so much. I know you covered a wide range there, but I thought it was absolutely perfect.
Thank you, and I hope it was informative.
Yes, very, very much. All right. Doesn't look like we have any questions in. So again, if you guys wind up having any questions later, you do have Patty's email address. So go ahead and shoot her that question and she can help you, okay? All right. Well, Patty, thank you very much for your time and you have a good day.
Thank you. You as well.
Bye.
Bye-bye.